guys, Dr. Lavan here. So today I thought I'd give you a quick little video on how to use nasal sprays and for what conditions. Now, nasal sprays typically are used for sinusitis and hay fever, and as you can imagine, over the last few months, just because of the weather and the season, we've had a lot more patients coming in complaining of this. The most important thing to realise with nasal sprays is the decongestants. Now, decongestants we normally purchase over the counter, and these can be actually a little bit of a problem. Obviously, for the short term, if you're suffering from pain in the face or feeling very congestion, the obvious thing is to use a decongestion. However, just be cautious. We have a lot of patients that come and see us and they say, "Doctor, I've been using it for 2 months and I've been using it 6-7 times a day, 2 bottles, and I'm really struggling." Now, there's where the problem is. Decongestions, unfortunately, are fantastic in terms of working for the short term, quick relief and relieving your symptoms. However, they shouldn't be used for long term because unfortunately they change the architecture of the nose and it makes your body want more and more of it to get the same effect. So be cautious about decongestions when we're using them. However, steroids, very good medication that we use typically in hay fever. Sometimes we can even avoid using oral tablets as a result of the effectiveness of something like a nasal spray. In a few videos time we'll talk about how nasal sprays can have an effect on other parts of the body. However, typically for this we're going to be talking about the nose. On to nasal steroids. Now, these can be purchased over the counter, but also you can get them from your GP. The reason I'm in front of these Egyptian pieces of art is last year I attended a conference in Belgium regarding asthma as well as nasal problems, and there was a technique they showed us that was very useful. Remember, when it comes to these sprays, it's really important to learn the technique efficiently because the effectiveness of the medication depends on your technique. Quite commonly, GPs, unfortunately, because we're so rushed, we tend to hand out these medications without giving the time to explain. So it's really important we explain how to use it, and maybe you have a quick way of learning how to use it. So, nasal sprays. It's quite important we look at this statue here, and this is Ramesses II, and the way he's actually holding his staff across his chest. Now, that's actually the technique to remember on how to use it. So remember, quick shake across your hands like this and point the spray just inside the nostril and spray. Similarly, same again, cross the arms, place just at the entrance and spray. It's really important we don't shoot it all the way up because obviously if the fluid runs at the back of the throat, it's not going to have the full effectiveness we need in this condition. And also if it's just at the entrance, you won't get much of the medication. So a quick reminder on how to use nasal steroid sprays by our friend over here, Ramesses. Remember, cross the arms over, slightly tilt the head forward, place just at the entrance and spray in a diagonal direction. And same again, tilt forward, cross the arms, place at the entrance and spray inside in the outer direction. Remember, we're going diagonally. So that video was just a quick reminder on how to use nasal sprays as well as being a little bit cautious about nasal decongestions. Stay well and thanks for watching.